We know vitamin B12 is important, but how can we tell if we have a deficiency? In this video, I will share some of the symptoms of vitamin B12 deficiency that should never be ignored. If you've got questions and comments, I would love to hear from you. Please leave them below. I'm Dr. Janine Bowring, naturopathic doctor and best-selling author. So the symptoms of vitamin B12 deficiency that we should never ignore include heart palpitations and any type of cardiovascular symptom that you may be experiencing. So that could be chest pains, it could be shortness of breath, and this is because B12 actually helps to remove something called homocysteine from the blood. And homocysteine is very damaging to the arteries and is something that we definitely, from a preventative standpoint, we have to keep our arteries nice and clear and healthy. And what happens when we have high homocysteine levels is that not only do we increase our risk for plaque formation in the arteries, which we can see here, but also for blood clotting. And when we have clotted blood and decrease in that circulation through those arteries, that of course increases our risk for cardiovascular disease. So any type of cardiac symptoms, you definitely also want to be checking out your B12 status to ensure that your levels are where they should be. So another symptom would be dizziness. So if you experience dizziness or you find that you have to sigh a lot during the day, taking deep breaths during the day, that would be another indication of a B12 deficiency, as well as lack of energy. So this is why most people will go to supplementation for vitamin B12 and the B vitamins is to increase their energy. If you feel weak and lightheaded during the day as well, that could also be that lack of vitamin B12. Also nerve problems, because of course B12 helps to protect our nerves and the myelin on the outside of the nerves. So much like in our nerve cells, we need that insulation, that's the myelin, and we need to protect those myelin sheaths with having enough of that B12. So if you experience tingling and numbness as well as muscle weakness and pins and needles, this could be related to that low B12. Even diabetics who have peripheral neuropathy, this would be another indication of potentially a low B12 level. And the way that I look at this is, you know, back in the day when we had dial-up internet, that would be not having that good myelin, but certainly with high-speed internet, that good myelin, those nerves are firing as they should and communicating with one another, and that's why, you know, it's very protective and preventative to ensure that we have enough of our B12 to protect our nervous system. And also walking difficulties. So imagine if your nerves are not firing as they should, then this can affect your gait and you could feel off balance or maybe even need, you know, assistance with walking. Again, could be related to vitamin B12 deficiency. Also vision loss. So the optic nerve at the back of the eye relies on, again, having that protection with that B12. And if you have blurry vision, this could be related to B12 deficiency as well. Also in terms of mental emotional symptoms, so whether it's depression, it could be lack of memory and memory loss, also mood disorders and behavioral problems, and we see this in the youngsters as well, but even going as far as paranoia and delusions can be related to a B12 deficiency. So it's important that, you know, we make these connections with not only our dietary lack of B12, but also in our environment, that, you know, the mind-body connection and what's happening in our environment with all of those EMFs and as well as that blue light radiation also could be depleting our B12 and can be causing some of these symptoms. A red, inflamed, sore tongue can be related, and getting a lot of canker sores can also be related to having a B12 deficiency. And this is something that I noticed in one of my daughter's friends who came over for dinner, and she said, "Janine, you got to check out my tongue. I don't know what's going on." So I said, "Okay, show me." So she stuck out her tongue, and it was big and red, and I said, "B12 deficiency, I can see it right away." And she said yes, she used to, you know, she was getting canker sores as well, and so as soon as she started taking her B12, guess what, it completely disappeared. So yeah, it's not something that is often talked about, but it's a simple fix, cause and effect. Fix that B12 deficiency and this will clear up as well. Poor memory, which we talked about, so lack of being able to remember things can be related to B12 deficiency, and skin disorders. So whether it's too much pigmentation, so hyperpigmentation and the darkening of spots on the skin can be related to low B12, but also lack of pigmentation, so vitiligo and those whitening of the skin can also be related to a low B12. So I hope you have some questions and comments. I would love to hear from you. Be sure to share this video with your friends and your loved ones, and please give me a big thumbs up. I truly appreciate it. Subscribe to my channel if you're new here, and also click that bell so you always get notified when I upload something new, which is just about every day now, which I'm so happy about. So remember to take good care of your health and to always do it naturally. Thanks for watching me today.